What is a trigger shot and how does it work? A trigger shot is an injection given during fertility treatments which induces the maturation and release of eggs from the ovaries, and ovulation happens about 36 hours after the shot. This precise timing allows your fertility doctor to time your intrauterine insemination or egg retrieval as part of your IVF cycle. There are two types of trigger shots. The first is an HCG or human chorionic gonadotropin shot. HCG is an important pregnancy hormone, but when used as a trigger shot, it mimics the action of the luteinizing hormone or LH. LH levels in your body rise prior to ovulation and they induce the final maturation and release of eggs from the ovaries. The second is a gonadotropin releasing hormone or GnRH agonist. This causes a natural rise in the LH levels in your body, which stimulates egg maturation and release. This is often used in women that are at an increased risk for developing ovarian hyperstimulation syndrome or when eggs are being retrieved for egg banking or egg donation. And lastly, a combination shot containing both. After monitoring your ovarian follicles using an ultrasound, your doctor will determine the right time for your trigger shot. The shot can either be taken intramuscularly or in your muscle or subcutaneously, that is under the skin. You can either self-administer the shot at home or you can go to your doctor's office to take the shot. Depending on the type of fertility treatment that you're undergoing, you will be scheduled for an intrauterine insemination about 24 to 36 hours after your trigger shot, or for an egg retrieval procedure as part of an IVF cycle about 36 hours after your trigger shot. In some cases where patients are not yet ready for an IUI or an IVF, a trigger shot can be used for timed sexual intercourse. It's important to do this, however, under the guidance of your doctor to make sure that it's safe for you. Some side effects commonly seen following a trigger shot are pain at the site of injection, abdominal bloating, and pain in your abdomen or pelvis. You may be at an increased risk for developing ovarian hyperstimulation syndrome, in which your ovaries swell up and become fluid-filled, especially after an HCG trigger shot. After reviewing the specifics of your case and your medical history, your fertility doctor will be able to recommend if you are a good candidate for a trigger shot and also determine the type and timing of your trigger shot.